I'm here.
Welcome. So you have 5 minutes. Tell us what's the lowdown on what's happening in Port-au-Prince and what people should know.
Sure. So there are 8 confirmed cases of COVID-19 in Haiti. The first few reported just over a week ago on March 19th. The situation hasn't yet reached epic proportions, but in my opinion, the government is taking this seriously. Since that announcement last week, the president instituted a mandatory curfew, schools have closed, public gatherings have been banned, and there is restricted air travel to Haiti. All measures taken to reduce local transmission. But from what I've seen, these measures haven't yet been fully adopted. So where I live in Port-au-Prince, pedestrian traffic remains pretty much the same at all times of day. So people aren't necessarily respecting the curfew or adhering to the social distancing measures. What we do see working well is the dissemination of flyers and print media, excuse me. So members of civil society and concerned citizens are sending flyers to encourage proper hand hygiene, and generally to spread World Health Organization guidelines. So that's been good. I get flyers all the time on WhatsApp and across all social media platforms.
Yeah, it's been like a WhatsApp university. Someone called it once, like that's how they're learning about everything that's happening. Now, Castelline, your case is very special because you came into Haiti after traveling and you felt a little bit ill and you thought maybe you had the virus, and then that was a bit of a scare for you. Can you share just briefly what measures you took, how is it addressed, and what's happening now?
Sure. So I traveled to California in early March. This was before there were any confirmed cases in Haiti. I came back and experienced those symptoms. I had a cough, I had a fever, chest pain. I thought, I'm going to be the first confirmed case in Haiti. I'm going to be stoned or hated by the entire population. This was my thought process. So after a week of having those symptoms, I decided to get help. I called the national laboratory, so Laboratoire National de Santé Publique, jokingly thinking they wouldn't help, but they took this very seriously. So I called on a Thursday. Friday morning, they sent 2 lab technicians to my address to test me. So the lab technicians came dressed in a hazmat suit. My neighbors looked at me oddly. I simply waved.
Did you take pictures by any chance?
No, I did not. But they came in, they took a sputum sample, took it back to the lab. It took 3 days for me to get my results. But in those 3 days, they had a doctor follow up with me to monitor my symptoms, to see how I was doing. Again, this was before any confirmed cases, so they probably had a smaller caseload and they could manage it very well. So I got frequent monitoring, and eventually I tested negative, but they also took contacts of everyone I had met after that trip. They would have quarantined them as well. So I do think the Ministry of Health, at the onset, they took this seriously, and given their limited capacity, they tried to test as widely as they could.
Good. That's good to know. Thank you so much. It's good to know that we are taking this seriously. We just have bigger issues to solve. Thank you so much, Castelline. Walna from Paris will be joining us and sharing how is France handling this pandemic, Paris specifically.
Hi, everyone. Hi, guys. So can you hear me?
Yes, very well.
Yeah. Okay, so in Paris, we've been on lockdown since March 16, and yesterday the government announced that it will be extended to April 15. So we have another 2 weeks to go. So how is it working here in France? So right now we have no right to be outside unless you are working or you have really a good business to be outside for. So we have this paper that we have to fill out. I don't know if you can see. So it says attestation de déplacement dérogatoire.
Wow.
So it means that you have to specify your name, your birth date, where you live, and you have to say why do you go out.
They don't have this in a digital format?
From the employer as well. Yes, I have it. We have it also on our phones, and we have the same thing from our employers, same thing. So with the logo, you also have to say why you are out. Other thing, the government also sent a text, sorry, because of the light, you can't probably see, but we have an official text. Everybody received it in France to say that you have to stay home where you're confined for these and these reasons. This is where you can find information. So basically, this is how it's going here in France. So I work from home. Most of the people, I can say that we are privileged to be able to work from home because we have Wi-Fi, we have internet, the markets are still open. We have markets close to our homes, so they regulate it. So they still try to, we try to respect the 6 feet, try to space the people between them. There are also some special time where the disabled people and the elderly can go for their market. So this is how it goes, I would say, for life in general.
Yeah.
When it comes to businesses, so a lot of people are now on partial unemployment. So the government has also unlocked some funds for the companies to delay their social contributions payments. For example, the tax payments, everything can be delayed up to 3 months. So allowing the companies to breathe out a little bit and to pay their employees. These are some measures that they are putting in place for all companies, big and small companies. Other things that are also developing is that because of the lack of PPEs in a lot of hospitals, in a lot of work environment, we are seeing a lot of, I would say, solidarity here. Some companies, chemical companies, for example, they'll have PPEs like masks, like gloves. They give them to the hospital. So they give them to the hospitals when they don't really need them. We have seen a lot of regions trying to help each other as well, because we have now reached a certain level of people in ECR, and not all the hospitals can handle it. So what we do in France is that if one region has less cases, they will welcome the patient, they will welcome the people, and try to treat them. So this is the situation right now here in France. We try to work it out. I can say that it works well, and it's just a little bit unfortunate that a lot of people really did not take it seriously here in France, because people were still outside, people were still in the parks, they were still having barbecues like 1-2 weeks ago, which makes no sense at all. So we just hope that now that the situation is getting a little bit more serious, every day, really every day, we have between 250 and 300 deaths per 24 hours.
Wow.
So it's really serious, and we have not reached the level of Italy or Spain, because yesterday Italy had like 900 people, 900 cases like death in one day.
Wow.
So every night here in France at 7 p.m., the government has a press conference where they give you the status of the cases, the status of the death, and so on. So it's a little bit, it's a little bit sad, because you read it and you just hope that the figures will, drop
Decrease.
and not start increasing, not continue to increase. But unfortunately, we are losing people, like hundreds of people each and every day. And so it's serious. Then this is how we handle it here in Paris. A lot of stores are closed. The streets are just empty. I am currently at my parents' house, and there is nobody in the street. Absolutely desert. Yeah.
Wow. Well, thank you so much, Walna. It sounds like there's a very interesting system in place for France, and they're obviously communicating to everybody via phone, which is a measure I hope we'll be able to take in Haiti as well. Thank you for sharing these insights with us. Moving on to Montreal. What's happening in Montreal? Carla, here to give us an update.
Hey, hi, everybody. Montreal, it's been quite crazy. Quebec is a province where you have more cases in the entire Canada. Montreal is the city where we have the most. We are now at 2,498 cases confirmed, 22 deaths. It's half of the cases of Canada. Montreal is really like the epicenter for Quebec. And my neighborhood where I live, it's one of the 3 most neighborhoods that are touched. So they don't know if they're gonna put Montreal in quarantine in the next few days. We will know about it because it's spreading, and they really want to contain the people in Montreal. So maybe like for the next couple days, people will not be able to go out or come in Montreal. So it's really stressful. I mean, but the response from the government is very great. We have press conference every day. They give us updates. The communication is really clear. We have like they did in French and in English. So they did a lot to help, because a lot of people lost their jobs. A lot of people cannot go work. Daycare are closed. Parents are staying home. So it's really, but at least we have help. We have help from the government. So basically starting, I think, April 3rd, everybody that lost their job or lost revenue, they're gonna have like $2,000 per month, up to 4 months. They also give subsidized to a company to keep their employees, so 75%. So they give that help to the different companies so they can keep their employees instead of putting them on chômage. I don't know how to say that in
unemployment.
Unemployment, yeah. And also they give help to families. So for example, for the child benefit support, they will have $300 more. They will give. So basically, they're doing a lot of efforts to help the businesses because most of the things are closed except groceries, drugstores. Everything's shutting down. All the small businesses. So they're really trying to help all the businesses and people. But we don't know yet until what time. They give a date. It's April 13, the full lockdown. But I'm pretty sure it's going to be more than that because we see a rise and we have still people, Canadians from abroad that are coming back.
Right.
So, and we see there's a wave every time we have people coming in. Some of them don't take it seriously, so they don't do the 14 days quarantine that they ask for. So now we're gonna have police are circulating, making sure they stay home. We have yesterday they said that we only can go out for groceries or essential needs. We cannot go have a walk more than 2 people at a time. We have to keep 2 meters social distancing. So it's a lot to take. And I always think about people like myself that I'm by myself with my daughter. So sometimes I cannot go out. I don't know how to do it. So it's really intense in Montreal and like everywhere else. But at least we have the government is really helping us and making everything clear and trying to help as much as possible people that are really in need.
Brilliant. That's a lot of interesting things that Canada is putting in place, at least in Quebec. Interesting to see how different countries are handling it differently. Different cities are handling it differently depending on the leader. So we've heard from Castelline in Haiti, Walna in France, and Carla in Canada. Now we're going to shift to the United States and get Naomy Grandpierre, who's in Atlanta, to share a little bit about what's happening in Atlanta.
Yeah.
Naomy?
Hello, I am based in Atlanta, Georgia. I'm with my family. We're all quarantined in our home. So I have a couple statistics about what kind of Atlanta and Georgia is doing to combat Corona. So currently, Georgia ranks 10th nationally in the number of confirmed cases. So we're definitely not at the same level as like New York, Boston, or Los Angeles. So things are definitely more chill and slower paced down in the South. There are about 2,000 confirmed cases and the death toll is 65. So the numbers are still pretty low, but it is still a problem here. It's actually interesting because young people are the leading age group of the COVID infection in Georgia. So that's very interesting. So this notion that like the disease is only affecting older people. One of the deaths was actually like a 16-year-old. So it is affecting a lot of people. The mayor tried to lock down the entire city, but the governor said no. And so the way that Georgia is doing it, the shelter in place or the stay-at-home lockdown is based on the county and how the numbers are representative in each. So it's just not statewide right now. So I think like where we are, it's Fulton County. So it actually has the most number of corona cases, but we're not forced to stay inside. So we're all quarantined and we do have a curfew. But like if you need to go to the grocery store, you can. All restaurants and non-essential businesses are closed. Pharmacies and groceries are still open. Delivery and other essential services are still operational. But for the majority of cases, all offices have moved to work from home. All schools have transitioned to online. So like I have younger siblings, both in college and high school, they're doing classes online. And I think the main conversation is getting enough medical supplies. And then also like the economic factor, that's a huge conversation in the United States. And I know it's been interesting because everyone is saying that Trump has put $2 trillion into fixing the economy, but has not put the same amount of effort in medical supplies. So that is unfortunately the priority in the United States. Everyone's really concerned about the job and the economy and how they're going to pay their bills in the next upcoming months. It's amazing that in Montreal, the government is going to support working class citizen with $2,000 a month. I think the bill just passed that working class citizens will get $1,200 and that's it. And then like everyone else has to figure it out on their own. So that's kind of the biggest update here in the States. It's very much state by state. And Georgia is definitely not in like an emergency lockdown as New York, but the main conversation is about the economy rather than the safety of everyone, unfortunately.
Wow, thank you so much, Naomi in Atlanta, telling us how Georgia and Atlanta and her county specifically is handling COVID-19. Next up, we have Santra in Miami. What's going on in Miami? How are people dealing? There's a lot of Haitians down there, and so the scare is coming through our WhatsApp channels very quickly. Tell us what's up, Santra.
Hi, everyone. Santra Denis from Miami. And I'd like to talk about Miami and South Florida in general because it's a very commuter kind of tri-county area, specifically Miami-Dade County and Broward. We are not necessarily on full lockdown. We have what's called a safer at home or shelter in place, kind of like what's coming from each county's mayor. So as you know, and what Naomi kind of talked about, our governor hasn't necessarily put in our humble opinion, put the necessary precautions in place to keep Floridians safe. And so you start to see the numbers really rising in both Miami-Dade County and Broward, leading actually the state in folks who are contracting corona. Right now, I think in Florida, we're already at 3,000 cases. And I'm not necessarily sure about how many of those cases have actually become deaths. We're seeing that young people actually have it as well. And so I want to echo Naomi in that as well. In terms of essential services, there are still a lot of places that are open. We're still seeing a lot of people not following social distancing. And so you can go to the grocery store and there'll be hundreds of folks there just hanging out. Where I'm hearing a lot from our
I saw some people on South Beach on the news.
People in South Beach. I mean, they're closed down the beaches and the parks. I mean, you wouldn't imagine the last 2 weeks, we've had perfect weather in South Florida, no rain, nothing. And so people are really struggling to kind of stay home. The other thing I'll kind of talk to that's specific to our community is that in the Haitian community in South Florida, they're heavily represented in the hospitality industry. So South Florida is known for tourism. There's a lot of hotels, a lot of restaurants. And so when those sectors go down, our community are heavily impacted. And so we already know that there are people who are not working at all, who don't get paid sick time off, who don't get PTO. And so there's no income coming into their households at all. So the $1,200 that we're talking about, you can't rent in Miami for less than $1,200 for an apartment. So we know that things are going to be tough in our community. We're also putting a few organizations came together actually yesterday to kind of talk about what are the immediate needs of the community. One of the things that I know some folks are talking about is that, second to the Spanish community, the Haitian community is the largest minority group in Florida. And we haven't necessarily seen any kind of press conferences in Haitian Creole. We're not seeing the PSAs in Haitian Creole. And so we really want to get some more messaging so that our folks know, so that they won't get in trouble. People are playing dominoes with their family. It's like all family reunion. And, we don't want police to show up to folks' doors because they didn't know, because they don't have the proper information. We're watching the churches closely. Some of them are abiding by the rules. A lot of them are not. And so talk to the pastors, but also making sure that our community know and take it very seriously. We're going to be hurting for a while in South Florida, specifically because tourism has come to a halt.
Wow. Still on South Beach, having a good time. I can definitely understand why that could be very scary. Thank you so much, Santra in Miami and South Florida, for giving us that very pertinent update. Last but not least, we have Kathleen Gonzales in Los Angeles, which was the scariest of all states just about a few weeks ago. So what's going on in Los Angeles, Kathleen? What can you tell us about what Los Angeles is doing right now in the wake of COVID-19?
Still pretty scary. When you think about the numbers, I believe it was January 26th was the first confirmed case in Orange County. And to now, like all over the state of California, there's over 4,000 confirmed cases. And in Los Angeles, as of March 27th, so yesterday at 12 p.m., there were 1,465 cases in Los Angeles County. 26 deaths. That's just Los Angeles County. That's it. Okay, I'm not talking the whole state, I'm just talking about Los Angeles County here. And then how it breaks down in terms of age range, 0 to 17 years of age, there are 22 confirmed cases. 18 to 40, there are 547 cases. 41 to 65, there are 565 cases, and over 65, there's only 268 cases, which is great because those are the most vulnerable. However, everyone is vulnerable.
Yeah.
So what the county is doing, so the mayor, Eric Garcetti, issued a safer at home order following the governor's safer at home order. And I just want to say it's an order. It's not a suggestion. And they have,
unlike Florida, where it's a recommended stay at home, this is like, right, you don't have a choice.
Pretty much, unless you're needed, right? So restaurants are not open to the public. However, they are open for takeout and delivery. Food stores are open. You know, obviously medical facilities, pharmacies are open. So those are just the places that are open or should be open at this point. And everybody else should be working from home or just not working. So what else have they done? Social distancing in terms of that, at grocery stores, they are practicing social distancing, which I think they're doing in a lot of places, or will be doing if they're not already doing it now. So they're only letting a certain number of people into the grocery store at a time. And the line outside of the grocery store are separated. Each person is separated by approximately 6 feet. So that is good.
But then what happens when you get in the grocery store and you're touching everything?
You know, and that's an issue as well. So what they have done for the most vulnerable is grocery stores sanitize in the morning, and I'm sure they're sanitizing throughout the day, because a lot of stores, like, they literally like wipe the door handle after each customer. And they're very, very careful. So they are allowing the most vulnerable, so the elderly and people with health issues, to come in first thing in the morning, and then everybody else later on in the day. So I think that's, you know, that's best. It's not fun for people who aren't dealing with that, but I think people are being very respectful and understanding of that. The only issue is that we do have the younger population who is like, woohoo, it's spring break time or whatever, and they're still going out. So what the county has had to do is close down the beaches, close down the parks, close down the walking trails, because people were going, you know, yes, you're supposed to be able to go outside and exercise if you need to, but the safer at home order went from do not congregate with more than 10 people to only participate in any activity outdoors with the people in your own home. Nobody else. So, you know, they're ramping it up pretty much every day. There are daily reports as to how things are changing, what's going on. Schools have been and are transitioning to online. So everything from preschools. One of my neighbors, she teaches at a preschool, and she's been teaching online. And universities are also moving classes online, colleges. Dorms at universities are pretty much only open to foreign students to lower the chances of, you know, transmission to the least amount of students as possible. So if people are not foreign, they're actually being asked to find housing off campus.
Wow. Putting a strain on that.
I'm sorry, go ahead.
Putting a strain on the student population to have to figure that out.
Yeah, pretty much. But good news, what they are, because they are anticipating quite a number of people, even more so than already has happened, are going to contract the coronavirus. So what they have put in place to
mitigate,
ready for that. So there is a beach called Dockweiler Beach. It is closed to the public now, but there's a section of it that has like RV parking. And so what they have done is they have RVs there ready in place to serve as quarantine housing for anyone who has coronavirus and who cannot self-quarantine.
Right.
So, you know, and Additionally, the U.S. naval ship Mercy was docked yesterday at the port of Los Angeles, which brought 1,000 more hospital rooms to Los Angeles for anyone who would normally be in the ICU who is a non-coronavirus case.
Right.
You know,
That's huge. And I think that's something that maybe Haiti can consider, is if there aren't enough resources in hospitals, how can we leverage partnerships with cruises to create beds and self-quarantine spaces where people can comfortably get access to resources and help that they need, because we already know the hospitals are already overflowing, and with coronavirus spreading, it might put a strain on the healthcare system. Thank you so much, ladies, for all of your inputs all over the world. Carla, Santra, Kathleen, Walna, Naomi, and Castelline. It's incredible to see how the entire world, our entire planet, is impacted by this. One positive thing I've seen is that in a way, the coronavirus is allowing our planet to heal, because there's less pressure on the roads, a lot less carbon transmission. People are having to find ways to connect more with each other. So as much as there is a very negative side of this pandemic, there's also a slightly positive side in how our planet is starting to heal itself, and how people are learning to behave differently because of what's happening. I want to thank everybody for coming on board. Karel, thank you so much for joining us and being our everything handyman, our technician, our live stream, there's a list, but we'll send you a thank you note. Really appreciate it. Hashtag He Builds With Us, we build together. Thank you so much to our global ambassadors all over the world who have been doing incredible work building the community, and to our panelists, DDIC, that you're still online. Thank you so much for contributing and just informing our community. It's so important for us to know what's going on. And each of you have been doing this in your communities. Thank you so much. Karel, you've been doing it through your show. I know you have a quarantine party going on. I'll bring my quarantini. Share the link. We'll be there with our sanitizers. Thank you so much, everyone. No problem. And you'll be, yeah. All right. Thank you so much, everyone. Have a wonderful rest of your day and stay safe.
Thanks.